Urologists put this in your patient's water, a simple, low-cost, evidence-informed ingredient you can consider recommending that supports nitric oxide physiology and may improve penile and peripheral perfusion in older men. I say may because the data are promising but not universal, and dietary strategies must be integrated with medication review, monitoring, and shared decision-making. This briefing is a clinician-to-clinician summary. Mechanism: the supporting evidence with verification notes, 7 practical drink options with suggested serving ranges, a 30-day stepwise protocol you can adapt in clinic, brief anonymized vignettes, safety and monitoring guidance, and language you can use with patients. Download the concise 30-day protocol PDF in the description if you want the print-ready handout for patients. I'll open with the core physiology. Nitric oxide is central to endothelial-dependent vasodilation and tissue perfusion. As patients age, particularly after 50, there is a documented decline in endothelial function and nitric oxide bioavailability, increased oxidative stress, and arterial stiffness. Dietary nitrates, abundant in beetroot, leafy greens, are reduced to nitrite and then to nitric oxide via enterosalivary and tissue pathways, offering an alternative substrate to enzymatic nitric oxide synthase when endogenous production is blunted. Polyphenols and antioxidants, found in pomegranate, green tea, and berries, appear to protect nitric oxide from oxidative breakdown and may prolong its vasodilatory effects. Together, a nitrate-rich, antioxidant-supportive beverage strategy can acutely improve peripheral blood flow and over days to weeks may translate into clinically meaningful changes in energy, warmth in the periphery, and sexual confidence for some men. Frame this as adjunctive, low-cost, and practical, not as a replacement for evidence-based pharmacologic ED therapies. What does the evidence say? Multiple lines of research support the physiology. Acute ingestion of nitrate-rich beetroot juice has been associated with reductions in blood pressure and improvements in endothelial function and exercise tolerance in middle-aged and older cohorts. Some crossover studies show hemodynamic effects within hours. Trials of polyphenol-rich pomegranate have suggested endothelial benefits and improved markers of oxidative stress in small studies. Green tea catechins and curcumin have anti-inflammatory and antioxidant properties that plausibly protect nitric oxide pathways. In terms of sexual health specifically, high-quality, large randomized trials are limited. There are small clinical reports and mechanistic studies suggesting improved penile blood flow or patient-reported benefits after nitrate or polyphenol intake, but these must be interpreted cautiously.
Where the transcript or prior notes list specific institutional citations that are unclear, for example, University of Exat, I have flagged these as Verify Citation. Before publishing any patient-facing materials or academic claims, confirm original sources and correct names. Notable journals that have published related work include Hypertension and Proceedings of the National Academy of Sciences, PNAS, but specific trial names and authors should be verified prior to citation in formal materials. Now, practical recommendations you can use in clinic. Below are 7 drink options, though what to put in the water, and reasonable suggested servings, followed by counseling points you can adapt. These are presented as suggested ranges and examples for patients. They should be validated for specific patients, comorbidities, medication lists, swallowing, or dietary restrictions. 1. Beet juice, a concentrated nitrate boost. Suggested serving, 4 to 6 ounces, 120 to 180 milliliters of prepared beetroot juice, or an equivalent portion of nitrate-rich beetroot concentrate, 2 to 3 times per week as a targeted nitrate source. Patients may start with a lower volume to assess tolerance. Mechanism: dietary inorganic nitrate, nitric oxide, provides a direct substrate for NO generation and has been associated with acute reductions in systolic and diastolic blood pressure and improved endothelial markers. Practical counseling: mix with orange or berry juice if taste is an issue. Warn patients about red urine or stool, beta-urea, which is benign. Cautions: monitor blood pressure and be cautious in patients and multiple antihypertensives. Advise medication reconciliation. If the patient uses long-acting nitrate medications or has recent nitrate exposure, discuss risks. Although dietary nitrate is not identical to medicinal nitrates, prudence is required. 2. Green tea, daily antioxidant support. Suggested serving, 1 to 2 cups daily, brewed gently to preserve catechins. Mechanism: catechins exert antioxidant and modest endothelial protective effects that can preserve nitric oxide signaling. Practical counseling: recommend consuming away from iron-rich meals for patients at risk of iron deficiency. If the patient is sensitive to caffeine, suggest decaffeinated options later in the day. Green tea may be particularly useful as a mid-morning beverage in the protocol. 3. Pomegranate juice, polyphenol-rich option. Suggested serving, 4 ounces, about 120 milliliters, of 100% pomegranate juice, 1 to 3 times per week as part of a nitrate plus antioxidant strategy. Mechanism: polyphenols may reduce oxidative breakdown of nitric oxide and improve endothelial markers in small studies. Practical counseling:
Choose 100% juice with no added sugar. Consider diluted preparations for glycemic control. Cautions. Account for caloric load in patients with diabetes and verify potential interactions with medications metabolized by cytochrome P450 enzymes. Consult pharmacy when in doubt.
Evidence. Smaller clinical studies suggest endothelial benefits. Larger trials are needed. Mark such sources for verification before using as primary citation. 4. Warm lemon water. Morning hydration primer. Suggested serving: half a lemon squeezed into 8 to 12 ounces of warm water each morning. Mechanism: simple hydration benefits, small vitamin C load that can act as an antioxidant, and a behavioral cue to begin the day with a vascular supportive routine. Practical counseling: recommend this as an easy, low-risk starting point for nearly all patients, especially those who will then consume a nitrate-rich beverage later in the morning. Cautions: enamel sensitivity. Advise using a straw and rinsing with plain water afterward if dental erosion is a concern. 5. Coffee plus dark chocolate, pragmatic stimulant plus flavanol pairing. Suggested serving: 1 small black coffee, 8 ounces, with 1 small square, 5 to 10 grams, of 70% or greater dark chocolate. Mechanism: coffee's acute hemodynamic effects vary by dose and tolerance. Cocoa flavanols may have endothelial benefits and can synergize with nitrate pathways. Practical counseling: for habitual coffee drinkers, this may be a convenient addition. Limit total added sugar and advise moderation. Cautions: in patients with uncontrolled hypertension or arrhythmias, tailor caffeine intake. Caffeine can transiently raise heart rate and may affect sleep. 6. Spinach and berry smoothie, nitrate plus anthocyanins plus fiber. Suggested serving: a blended smoothie containing a handful to a cup of fresh spinach, nitrate source, a half cup of mixed berries, anthocyanins, water or unsweetened plant milk, and an optional protein scoop. Mechanism: leafy greens supply dietary nitrate. Berries provide antioxidants that protect nitric oxide and have anti-inflammatory properties. Fiber supports metabolic health. Practical counseling: suggest preparing smoothies in the morning as part of a consistent routine. For patients with swallowing issues, texture modifications are possible. Cautions: evaluate caloric load and sugar content for metabolic syndrome patients. 7. Golden milk, turmeric anti-inflammatory evening option. Suggested serving: 1 cup of warm milk, dairy or plant-based, with 1/2 to 1 teaspoon of turmeric powder plus a pinch of black pepper to enhance curcumin absorption, consumed in the evening as part of a recovery anti-inflammatory ritual. Mechanism: curcumin has anti-inflammatory properties that may reduce chronic vascular inflammation and protect endothelial function over time. Practical counseling: remind patients that curcumin bioavailability is limited without pepper or fat. Intermittently use is reasonable. Cautions: check for anticoagulant use. Turmeric can affect clotting in high doses, and other herb-drug interactions. Ask pharmacy to verify for complex regimens.
For each drink, emphasize that the benefit is likely synergistic. Nitrate provides substrate for nitric oxide. Polyphenols and antioxidants protect NO and reduce oxidative stress. Anti-inflammatory agents reduce the chronic vascular burden. Timing matters. Nitrates can have acute effects within hours, whereas antioxidant and anti-inflammatory benefits are more cumulative over days to weeks. A simple way to counsel patients is to frame a morning priming beverage, lemon water or beetroot, a midday antioxidant, green tea or pomegranate, a nutrient-dense breakfast, smoothie, and an evening anti-inflammatory, golden milk, as a coherent strategy that is easy to implement. Short, anonymized vignettes to illustrate potential real-world observations in patients you might see. These are illustrative cases, not proof of efficacy, and outcomes are individual. Mark, 63, with hypertension controlled on a single agent and mild endothelial dysfunction on prior testing, began a targeted regimen: warm lemon water on waking, 4-ounce beet juice twice weekly, and green tea daily. He reported increased peripheral warmth and improved morning energy within 2 weeks, and subjective improvement in erectile confidence at 3 weeks. Blood pressure logs showed a modest decrease of 5 to 8 millimeters Hg systolic in the first month. His antihypertensive dose was reviewed and adjusted by his primary physician. Mark's experience suggests the combination can influence symptoms and hemodynamics, but it required medication reconciliation and monitoring. George, 66, on an established PDE5 inhibitor regimen, added a spinach and berry smoothie and 1 square of 70. Days 0 through 3. Baseline assessment and medication reconciliation. Record baseline blood pressure, home log or clinic measurement. Review all medications, particularly prescription nitrates, PDE5 inhibitors, and multiple antihypertensives, and confirm absence of active cardiac ischemia or unstable hemodynamics. Ask the patient to complete a brief symptom diary, noting energy, peripheral warmth, and baseline erectile function, using a validated instrument if available, for example, IEEF5. Use the version typically used in your practice. If the patient is on nitrates or complex cardiovascular regimens, consult the prescribing clinician or pharmacist prior to initiating. Days 4 through 30. Implement the daily beverage plan. Suggested routine. Morning, warm lemon water on waking. 30 to 60 minutes later, choose either a 4-ounce beet juice, start with once every other day, and progress to 2 to 3 times per week, or a spinach and berry smoothie daily, if nitrate tolerance or taste preferences favor it. Mid-morning, 1 cup of green tea. Optional. If the patient typically consumes coffee, advise 1 small black coffee with a 5 to 10 gram square of 70% dark chocolate. Lunch/day. Include nitrate-rich vegetables when possible, leafy side salad. Evening, golden milk 3 to 4 times per week for anti-inflammatory support. Encourage consistent timing and a short daily log, blood pressure once in the morning and once in the evening for the first 2 weeks, and symptom diary entry every other day, noting energy, warmth, and sexual confidence. After 2 weeks, review the logs. If BP reductions are significant, greater than 10 mm Hg systolic from baseline, or symptomatic hypotension occurs, dizziness, syncope, presyncope, pause the regimen and coordinate medication adjustment with the primary care clinician. If symptoms are improving without adverse effects, continue through day 30. End of 30 days. Reassess using the symptom diary and any validated erectile function scale used at baseline. Decide jointly whether to continue, modify, or stop specific elements. If clinically helpful, encourage ongoing dietary incorporation rather than short-term use only. Document outcomes in the chart. If you intend to collect data for an informal clinical audit, ensure proper de-identification, and a formal research is planned, obtain IRB approval. Safety, contraindications, and monitoring cannot be overstated. Before suggesting any high nitrate dietary plan, perform a medication reconciliation. Key points for safety counseling include the following. First, medicinal nitrates, sublingual nitroglycerin, isosorbate mononitrate dinitrate, and phosphodiesterase type 5 inhibitors, sildenafil, tadalafil, etc., have well-established interactions. Concomitant use of nitrates and PDE5 inhibitors greatly increases the risk of clinically significant hypoteptin.
Dietary nitrates are not equivalent to prescription nitrates in pharmacology, but because dietary nitrates can lower blood pressure, advise caution and clear guidance for patients taking PDE5 inhibitors. Do not change medication regimens without consultation. For patients on PDE5 inhibitors who wish to trial high nitrate beverages, document informed consent, emphasize monitoring for symptoms, and coordinate timing, for example, monitoring periods when PDE5 inhibitors are not at peak plasma levels. When in doubt, involve the prescribing clinician or pharmacist. Second, antihypertensive polytherapy increases the risk of symptomatic hypotension when adding vasodilatory dietary components. For patients on multiple agents, particularly alpha blockers, nitrates, or combined vasodilators, recommend closer BP monitoring and communication with the primary care physician for possible dose adjustments. Third, certain herbal supplements and foods have potential interactions. Turmeric, curcumin, has mild antiplatelet effects in some reports and may interact with anticoagulants. Pomegranate constituents can influence drug metabolism enzymes. Consult pharmacy when patients are taking drugs with narrow therapeutic indices. Check for allergies and tolerability, especially for concentrated juices. Fourth, metabolic concerns. Concentrated fruit juices can be high in sugars. In patients with diabetes or metabolic syndrome, recommend dilution, portion control, or prefer nitrate-rich vegetables and smoothies with low-sugar berries and added protein/fiber. Monitoring recommendations to implement in practice. Ask patients to record daily blood pressure readings, morning and evening, for the first 2 weeks, then 3 times weekly afterward if stable. Have patients use a symptom diary, noting fatigue, dizziness, peripheral warmth, urinary or sexual function changes, and any episodes of presyncope, syncope. Use a validated erectile function questionnaire at baseline and at 30 days if sexual outcomes are the focus. Document medication reconciliation and plan in the medical record, and instruct the patient to seek urgent care for syncope or severe hypotension. Decision thresholds for escalation or stopping. If systolic BP drops by more than 15 to 20 millimeters Hg from baseline, or the patient reports symptomatic dizziness or syncope, pause the intervention and review medications. If there is no subjective or objective improvement after 30 days and symptoms persist or worsen, escalate care. Consider referral or reevaluation for alternative etiologies of erectile dysfunction, hormonal, neurologic, structural, and do not attribute lack of response solely to dietary factors. Implementation tips and suggested phrasing when you introduce this option to patients. Keep it brief, collaborative, and evidence-framed.
I want to offer a low-risk lifestyle adjunct that may help with circulation and energy. It's not a replacement for your prescribed therapy, but some patients experience improved warmth, stamina, and confidence. If you're willing, we can try a 30-day protocol of small nitrate-rich and antioxidant beverages. Before we start, I'll review your medications and your blood pressure plan so we can monitor safely. If you notice dizziness or large BP changes, stop and call immediately. This shared decision script sets expectations, emphasizes safety, and invites adherence monitoring. Documentation and quality improvement. If you plan to trial this routinely, create a short template in the chart: baseline BP, medication list, IIEF-5 score or other instrument, agreed protocol elements, and monitoring plan. Encourage patients to bring or upload home BP logs. Consider a small internal audit after 20-30 patients to assess tolerability, medication adjustments required, and proportion noting subjective improvements. If data collection is intended for wider dissemination, confirm ethical review and consent processes. A concise monitoring checklist you can print and provide to patients or use as a clinical prompt. Verify medications, baseline BP, home BP monitor instructions, symptom diary template, energy, warmth, sexual confidence, dizziness, planned beverage choices and servings, frequency of intake, emergency contact plan, and follow-up date at 2 weeks and 30 days. Use this to standardize counseling and reduce variability. A few practical counseling pearls that help adherence. First, target small, sustainable changes rather than complex routines. Patients are more likely to stick with a single favorite morning beverage than a multi-step plan they cannot maintain. Second, taste and convenience matter. Offer acceptable flavoring suggestions. Mix beet with orange, dilute juices, add a pinch of salt if orthostatic intolerance is an issue, but consult cardiology for persistent symptoms. Third, address cost. Suggest frozen berries, bulk spinach, and small bottles of beet concentrate as cost-effective options. Fourth, set realistic expectations. Tell patients that some people perceive changes within days or weeks, but others may not notice changes in erectile function despite hemodynamic improvements. On evidence rigor and citation verification, a number of small trials and mechanistic studies support dietary nitrate and polyphenol benefits for endothelial function and blood pressure in older adults. However, for claims about sexual function specifically, the body of randomized controlled evidence is limited and heterogeneous. Before referencing specific trials or institutions in patient education or scholarly content, confirm source names, authors, sample sizes, and endpoints. Where the transcript or prior notes list uncertain affiliations, for example, University of Exat, confirm institutional names and references. Mark such items as verify citation in your drafts until verified. Ethical and regulatory cautions. Do not present these beverages as a replacement for prescribed ED medications or as a guaranteed means of restoring erections. All counseling should include an explicit verbal disclaimer that this is educational and adjunctive. Consider an on-screen or written statement for patient handouts. This information is educational only and not a substitute for individualized medical advice. Discuss any changes with your healthcare team. Do not stop prescribed medications without supervision. Finally, a brief appendix of suggested language for patient handouts and a one-page clinician script that you can place in the electronic health record note. Patient handout suggested text, concise. A possible low-risk beverage plan to support circulation. 1. Morning, warm lemon water. 2. Within the morning, one of the following: 4 ounces beet juice twice weekly, or a spinach and berry smoothie daily. 3. Midday, 1 cup green tea. 4. Optional, small black coffee plus 1 square, 5 to 10 grams, 70% dark chocolate. 5. Evening, golden milk 3 times per week. Monitor blood pressure daily for first 2 weeks. If you take nitrates or multiple blood pressure medications or experience dizziness, stop and call your provider. This is an adjunctive approach and not a replacement for prescribed therapies. Clinician one-liner to document and chart. Discussed adjunctive dietary nitrate antioxidant beverage protocol with patient. Reviewed medication list and BP plan. Patient agrees to 30-day trial with home BP monitoring and follow-up in 2 weeks. Potential pitfalls and how to avoid them. Overemphasizing anecdote.
Always frame case vignettes as individual, not generalized. Underestimating hemodynamic effects. Even dietary interventions can influence blood pressure. Plan monitoring. Ignoring medication interactions. Perform a thorough med reconciliation and consult pharmacy when needed. Failing to verify citations. Before distributing educational materials, check original studies, correct institution names, and ensure accurate representation of effect sizes and endpoints. If you see unclear references like University of Exat or unfamiliar study names in prior notes, tag them for verification and do not present them as authoritative until confirmed. Suggested metrics for a simple clinic audit. Record the number of consenting patients who start the protocol, the number who complete 30 days, mean change in home systolic BP at 30 days, proportion with self-reported improvement in energy or warmth, and proportion with self-reported improvement in sexual confidence or erectile function using a validated instrument. Track adverse events. Symptomatic hypotension, hypoglycemia due to dietary changes in diabetics, allergic reactions. This gives a pragmatic sense of tolerability and signal of benefit before undertaking larger-scale data collection.
References and verification notes include primary sources for dietary nitrate physiology and endothelial outcomes, example journals, hypertension, PNAS, and smaller clinical trials that assessed beetroot juice and related interventions in older adults. Any specific trial or institutional affiliation that is not independently verified should be marked Verify Citation. Before publishing or using informal materials, replace placeholders with conformed citations and provide links in the video description or handout. Closing, colleagues. The rationale is straightforward. Support nitric oxide substrate and protect it from oxidative degradation using accessible dietary options that patients can implement with minimal cost and intrusion. Some patients will experience measurable hemodynamic and symptomatic benefits, others will not. The clinical value lies in low risk, ease of adoption, and the potential to improve vascular health and patient confidence, especially when combined with appropriate monitoring and drug safety checks. This is an adjunctive approach. Use it where appropriate, monitor carefully, and document outcomes. If you trial this with consenting patients, consider collecting anonymized outcomes and sharing findings in our clinician forum so we can learn collectively. If you'd like the Principal 30-day protocol, the monitoring checklist, and the patient handout formatted for clinic printing, download the PDF in the description and adapt it to your practice. If you implement a short audit and are willing to share de-identified aggregate results, please join the clinician discussion linked below. Medical disclaimer. This content is for educational purposes only and does not substitute individualized medical advice. Before recommending dietary changes with potential hemodynamic effects, verify the patient's medication list, consult pharmacy as needed, and ensure appropriate blood pressure monitoring. Do not combine medicinal nitrates and PDE5 inhibitors without specialist input, and instruct patients to seek immediate care for severe dizziness, fainting, or other concerning symptoms. Verify all study citations prior to publication. Items marked Verify Citation require confirmation. Thank you for adopting a curious, safety-first approach to conservative vascular support strategies in older men. If you trial this protocol with consenting patients, consider sharing anonymized outcomes in the clinician forum. And if you found this briefing useful, subscribe for weekly clinical updates and resources.